Can you talk a little bit about how, like what's a way that cell ed gets used to alleviate some of these issues in a community?
Yeah, I'll start with one example. We call it Skills for Life. It's one of our projects. Essentially, it's taking a lot of the essential skills that you would think of from reading, writing, math, but let's not forget work readiness, citizenship pathway programming, parenting education. There's just so many areas that we all need to have access to adequate information and skills to be able to navigate better. But what happens if you find yourself without a job? You find yourself without access to, formal education. Well, in many cases, that happens across the US if you are applying for benefits with the Department of Social Services in a state or through a county. So we got an ability to be an arm, if you will, to these Department of Social Services. So folks just learn that they no longer have a job or they're underemployed, they would gain access to CellEd to get these countable hours they need in order to receive their benefit. So instead of having to go into a program or to have a terminal, a computer where they can log in, they can essentially, with a phone number, be able to access education and coaching in the palm of their hand. That one can be really broadly applied globally as well. Then we've got ones that are going a little deeper. I'll say we'll go deep, and when we're talking now, if you need to go, if you have figured out or have learned from your physician that you are suffering from peripheral artery disease or another chronic disease, what if you could be prescribed with the idea? And this is called Get Set, get supervised exercise training in the palm of your hand. You could have this 12-week, you get cognitive behavioral coaching and support, you get access to this programming about this chronic disease burden framed in a positive way, right? Patients aren't diseases, they're humans. They have these incredible goals. Why don't we learn about that and then figure out how we can support them on their learning journey around better health? That's another example that we can and have been able to offer through health systems and through public health and other community-based health providers. And I think the last, which is pretty relevant and has been for a while, is we call it Welcome Start. Everybody should have a warm welcome. And in this case, reaching our immigrant, migrant, and other communities with the access of information they need to get to, to A to B, but from where they're at, not necessarily telling them, what they need, but what they want